Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and every August, those of you that live here know well that the city of Sturgis transforms into one of the world's, well, it's not one of the world's, it is the world's biggest motorcycle rally. It's the engines, the packed streets, the good times, but it's also a time when healthcare needs really spike. And so joining me today back on the podcast is Dr. Joy Mueller, who is a family medicine doctor right here in Sturgis. And we're going to talk to her about what it takes to prepare for and survive the chaos that comes with the rally. We're going to talk about how locals and visitors can stay safe, healthy, and enjoy the experience without a hitch. Welcome, Dr. Mueller. I can't believe we're already talking about the rally. Didn't it just get over? It feels like it. Yes. Do you get excited? I mean,
I do. I grew up in the area. I grew up in Keystone, so I grew up with rally visitors, and it's definitely a unique crowd. People come from far and wide.
That's a good way to put it.
Well, and honestly, being around it as a young person, I loved it because it was just such a different feeling. When you're taking care of people in the restaurant setting, a lot of them have nowhere to be, and they just can be as patient as possible. And as long as you're refilling their drinks and stuff like that, they can wait. And it's different than the usual crowd that has a bunch of young kids and different, places to be and things to do. And so it was just such a unique experience. I loved it. I had to get rides back and forth to work as a teenager. I couldn't walk. But that was, tips were good. And I looked forward to it every year. As a physician now, I look forward to it in a different way. It's definitely something that you get to practice kind of all the skills that you don't use on a regular basis throughout the year. In Sturgis, we're really, it's a unique style of practice. One of two within our monument system where the family medicine physicians not only practice in clinic and take care of patients in clinic, but we also take care of patients in the ER and hospital. And so
that's not a common thing?
Not as much anymore. Most places will have a family medicine doc will see patients in clinic. A family medicine doc might see patients in the hospital, or it might be internal medicine doctors. And each specialty has their strong kind of where they've built up extra skills, and each specialty, obviously surgeons go and do extra training in surgery, that kind of stuff, and depending on how specialized they are, they might spend a lot of extra time. And within family medicine, we spend our time learning all the different areas and then continuing to grow in the areas that we see ourselves practicing, both in residency or in training, and then after that. And so those of us working in Sturgis have chosen to continue to do all three things. So we, one of the things that we're trained in that we don't routinely practice is delivering babies. That's something that's still within the scope of a family medicine physician.
Does that happen during the rally too?
I have
Every
not.
Once in a while, not yet.
I haven't had that experience. Never say never.
Right,
but,
exactly.
No, but that's so we get the opportunity. We practice in the ER throughout the year, but this is a different set of skills that we get to practice daily that might only come up once or twice a year otherwise.
And it's got to be all hands on deck too. I mean, for that 10 days to 2 weeks. So it's good that you guys have all of that experience.
It is. We, throughout the year, we have kind of our model and how many docs, how many nurses in different parts of the hospital, ER, that kind of thing, where our staff is devoting their time. And every year during the rally, it shifts quite dramatically. We get a lot more nursing help. Or the nurses are scheduled to more of them in the ER, that kind of stuff. Also on the hospital floor, because there are some people who end up getting admitted for further care of whatever brought them into the ER in the first place. And the physicians, not only do we get more nursing help, but we also get more physician help. So there's more of us that are working at a time. For the last several years, I want to say it's 8 or so years now, we've had some locums docs come in and work at night in the Sturgis Emergency Department. So they are two specific physicians that have come and help us year after year, and they help take care of patients overnight. And the local docs will continue, we might have a shift from 7 a.m. to 7 p.m. or 6 p.m. to 2 a.m. to make sure there's adequate coverage. But that also helps kind of make sure that there's enough of us throughout the 24-hour time frame to make sure everybody's getting their needs met. You can imagine there's a bit of an influx of patients between midnight and 2 a.m.
What?
And
everybody's supposed to be sleeping at that point, Doctor.
Right. And so we like to make sure that we're staffed to get everybody what they need. The needs can be everything from, tipping over their bike and rolling their ankle, with or without a brake, road rash, heat exhaustion sometimes, dehydration. Too much of any substance is not a good thing, and sometimes needs some additional help.
So are those some of the biggest health challenges you see
I'd say
for that time of year?
Yeah, I'd say there's definitely the trauma-related things, whether it's being under the influence and, rolling your ankle in a pond at whatever hotel or at whatever campground you're staying at, and then realizing that you can't bear any weight on that ankle, so you come in and get it checked out. Yes, it's broke. What can we do to help? Motorcycle-related wrecks for sure, weather, heat exhaustion, that kind of stuff. But there's also, and then there can be the big wrecks and the big trauma, always that kind of stuff. But then there's also the people who come out for a week and forgot that they were prescribed some medications for their heart or for their lungs, or maybe just were having too much fun to remember to take those. People with chronic illnesses come out and have a good time also, and we want to make sure they get the care they need. But yeah, it's bugs in the eye, all that kind of stuff.
Those are the kind of things you don't really think of, too.
Yeah.
I'm thinking about, as you're saying this and how you staff up and everything. We're a state of about 880,000 people, all told, from east to west. And during the rally, it's 500,000 to as high as 1 million. We've had those numbers come in. So double the size of the state almost. It just seems like you guys would be just frayed during that time with all of these people here and everything that can happen.
I would say if we were dealing with it in isolation, yes. If we had never done this before, yes, that would be very stressful. But we've been doing this for a lot of years. We have a very well-oiled machine. We make adjustments every year. Of course, we would accommodate for, the 75th anniversary was a really big numbers, and our volume at the hospital emergency department reflected that. And when we talk about those numbers, it's not just Sturgis. That's all the surrounding communities, right? So not only does Sturgis feel an influx, but Spearfish, Deadwood, Rapid City. And not only do we want to take good care of all of our visitors, but our residents who are here, all of the staff that is working these booths, taking care of people, need their care also. And so that's one of the big things over the last several years we've worked hard in Sturgis to help accommodate is several years ago, a decade or more ago, the only way to receive care in the Sturgis area was through the emergency department. All of the locals just knew if they wanted to be seen, they had to get their needs taken care of before the rally started or afterwards. And that's not wrong because it can be hard to get around for sure.
Of course.
And so, your every 3-month diabetic check might not feel like it meets the threshold for getting, or if you live out of town quite a ways, we service a huge geographical area in Sturgis. A lot of those people from far east of us have zero desire to come into Sturgis during that time. And so we definitely accommodate those things. Right now, if I'm looking at somebody's follow-up and I say, well, looks like we're due for follow-up beginning of August, and they'll say, nope, okay, that's fine. We can go earlier, we can go later, those kind of things. But I'd say within the last several years, we started doing urgent care services right after the 75th anniversary. We have a very active same-day services, and that's really grown and accommodated more of those needs. And then within the last 3 years, we now have primary care. So your family medicine docs and APPs will have different amounts of availability in clinic also. So if you are one of the people who's like, it's just any other time of year, I don't leave, I'd still like to do my annual wellness, there are clinic spots available for that, which is nice. So the people who are just, it's a routine part of their year, and maybe they're snowbirds, so they've only got so many months to take care of their needs while they're here, and they don't want to miss out on that 2 to 3 weeks to get those needs met. Sturgis is now able to accommodate everybody, from our visitors to the workers to the residents, and that's a great thing we've worked towards achieving and making sure our staffing can keep up with that.
So, like with the when it comes to the ambulance side of that in the ER, do you guys are more units brought in for this too? Are you guys able to accommodate?
So within the city of Sturgis, our EMS service is not under Monument. We work closely with them, and one of our physicians is the medical director for the EMS service. But yeah, they definitely have a very different staffing model.
Oh, I see. Okay.
And more availability, but they are a very busy group of people. They provide excellent care. There's a lot more life flight kind of or air ambulance, fixed wing and rotor services available. So they're, instead of just having, and there's several companies that do that, instead of just having 1 or 2 available, there will be some stationed in Spearfish, I believe, Rapid City.
Okay.
There are fixed wings that are located in Rapid City, ready to take people somewhere if needed. But one of the great things now is we can really address most of people's needs in the Black Hills area with all the support of the specialists in Rapid City. So Sturgis itself is a community access or critical access hospital, which means we have approximately 6 beds during the normal time of year in the emergency department, and then we add about 3 other areas to take care of patients, 3 other beds to our emergency department, and then we have 24 inpatient beds. But that's a very finite number, and so we definitely rely on the support and collaboration with our surrounding facilities. Rapid City has the ortho trauma. They have the trauma service if somebody were to need neurosurgery or something like that. Those services are all available in Rapid City. So if you receive an injury that means you need that very high level of care, our job is to get you stabilized and get you going to the location where you can receive the definitive care, such as Rapid City. And everybody, Rapid City, everybody preps to make sure we are ready and able, and we have the staff available, the OR time available, all those services. And so it's a collaborative effort to make sure everybody gets the care they need. If you have a bad motor vehicle accident at any location within the hills, the EMS is going to work, and dispatch and all those, they're going to work to make sure that you are picked up by the closest EMS service. If it meets the criteria of needing the air transport, they might pick you up on scene, and then they would most often transport you to Rapid City, where you can receive that definitive care rather than stopping along the way. But if you're on an ambulance, then you would be brought to the next closest hospital with those where that need can be met, make sure you're stable, and then get you going to the next spot. Because
that organization to me seems amazing. Just mind-boggling.
It is.
The coordination. Yep,
and it's just over time, growing and fine-tuning. If there's a lot of pre-rally meetings, post-rally wrap-ups. How did this go? Here's a situation we hadn't run into before. Is there something we could do different? Not only on the hospital side, but within the community as far as first responders, law enforcement, EMS, hospital. If there was ever a bigger event, the kind of stuff we all talk about and prepare for, there would be a lot of, review after the fact to make sure. And every year, some of the motorcycle clubs, not every year, on certain years, the motorcycle clubs will have big annual meetings, and we always know about that ahead of time. That doesn't affect us, our staffing specifically, but we always want to be aware to make sure we're taking care of the needs and have those kind of availabilities. So yeah, between our staffing in the hospital, adjusting and being prepared, always, more people on call for that kind of stuff. We also work with like the Christian Motorcycle Association. They provide services as far as helping arrange for people to get home if that's what they want. Say you're one of those people that rolled your bike or laid down your bike and broke your ankle. It's going to be hard to ride that bike home. And so you might need some assistance in trying to figure out transportation, not only for you, but for your bike back home, wherever you came from. So that's a group that provides their volunteer services to help with arranging. Within the last 3 years at Sturgis Monument, we've had a hospitality room within the hospital to help provide a comfortable space for our first responders to kind of
Just
recharge
unwind a little bit, yeah.
Recharge, and they spend a lot of time bringing us people, and sometimes picking, EMS picking up people and taking them to Rapid City, and so snacks, drinks, that kind of stuff to make sure everybody's getting fed, because it's also hard to get to the grocery store. It's anybody who stood in line for some of the excellent vendor food we have, it takes time and parking and walking and that kind of stuff. So we like to make sure we try and take care of everybody.
Well, do you get a chance to enjoy it anymore? I
Yeah.
mean, do you still get to go and?
Yeah, I do. I really look forward to certain food vendors every year. I like to go up and walk around. My kids get a big kick out of looking at all the bikes, and we like to go for drives. And obviously, they're not old enough to probably walk downtown and see a lot firsthand yet, but they really get a kick out of looking at everything. My 8-year-old will talk about, Mom, it's so much fun to live in a big city where there's lots of people, but it's okay that they go home, and then we have our small city back. And it's so true. I think that's the beauty of being.
A lot of us feel that way.
Right. It's kind of fun to have all the visitors and the.
Totally.
And they're a really nice, appreciative group of people. A lot of them come from areas that maybe healthcare is harder to access, or there are really long wait times. And so we over and over again hear they're so impressed with how we do things, and they didn't know what was going to happen, because a stop at the hospital or same-day services is not something most people plan for in this vacation. So whether it's a motor vehicle accident, heat exhaustion, or they just forgot to take those pills their primary care doctor provided for them. Sometimes it can be challenging because we wouldn't necessarily have access to all of their records from wherever they're from, but that's definitely getting better as our electronic medical records.
Sometimes it's hard to track that down.
It can be hard,
but it's thought of that either. Yeah,
but it's easier. Every year, and as more systems across the nation get
kind of integrated. And
but those kind of things, it's not earth-shattering details, but as long as we can take good care of each individual patient and making sure we're doing the best we can to meet their needs. One of the other, the hospitality, one of the other things that we have a heightened awareness for during that time of year is human trafficking. We've all seen the billboards on the interstate and stuff like that. So over the years, people will pre-rally come in and visit with us a little bit about the different kinds of human trafficking, how we can be aware, how we can be supportive, the most thoughtful ways to ask questions. Are you looking for a help to leave that situation that you're currently in? It seems like, maybe it's a worker who was brought here under kind of false pretenses, thinking they were going to make a ton of money, and then their rent for where they're having to stay is exorbitant, so they can't make the ends meet, and then they come see us for whatever reason. So it's just an awareness and how we can provide that support. It's a real thing. We want to make sure we're as supportive of the whole process as we can and get people hooked up with the right resources if that's what they're looking for, because they might come to us looking to us as a safe space to get help.
Boy, another thing, you've brought up a handful of things already that I don't think just a lot of people think about when the rally is here. They think of people that end up in the motorcycle accidents, probably get too drunk and something there happens, maybe a little heat exhaustion too. Are there other things that you specifically see during the rally outside of things like that locals and riders should be aware of? Right.
I'd say just there's checking your mirrors. There's just the defensive driving that we've all been taught, and I think most of us who learned how to drive cars, trucks, that kind of stuff. And most of us around here are used to driving bigger vehicles, and we are aware of motorcycles, but it takes that extra step of caution to make sure that we're extra aware, because a lot of groups who come here on motorcycles together work really hard to stay together in a group.
Right.
And so there's definitely a amount of grace that needs to be given for maybe stretching the rules of the road a little bit.
I'm glad you brought that point up, because that always seems to be one of the biggest frustrations that we will joke about, like on the radio and during shows and things like that, is patience is the number one thing, I believe, during the rally.
Yeah.
Yes, you're going to have a group of 12 bikes. The light's going to go from yellow to red. 3 of them are still wanting to be with that group, and they're going to go.
Yep.
They're not going to wait.
Yep.
So you can be mad about it, or you can be,
right.
All right, I get it. You guys, you leave in a week.
Right. And it's just, a lot of that kind of stuff. Eye protection, we don't have the mandated helmet laws, but there's definitely a difference in outcomes for people who make contact with the pavement, who have helmets on and leathers on. But of course, we're very understanding of people and their preferences. I'd say being aware of your body's limits, same as if you are not used to living that high fun,
you haven't
less
trained
sleep
for it yet.
Well, I think some people live with those decisions on a more regular basis, and others probably need a little bit more recovery time. But just having the patience and the grace for the people around you, trying to take good care of people. We always want to be thoughtful of people who are coming to the area who maybe aren't familiar with the roads.
Right.
A lot of our roads have gravel on the shoulders that can be hazardous.
On a bike, that's dangerous.
Yep. Weather can really slow people down. People end up on gravel roads that they never meant to end up on, or they've never ridden on a gravel road on their bike before. So, but speeding past them at 60 miles an hour on that gravel road probably isn't going to help the bigger situation and won't make the point that you're hoping to make.
Right. Never does.
Right. But, and it is a brief amount of time, but we want to be good hosts.
Yes, good hosts, good stewards of the Black Hills, I suppose.
Yeah, and there's a reason people love coming here.
Yeah, exactly.
It's a very relaxed atmosphere, usually. Lots of fun stuff to see, lots of different types of events to go to, whether it's one of the big campground venues and all the concerts. Maybe it's experiencing the long rides to some of the outlying communities. But it's just beautiful, and everybody talks about how beautiful it is, how nice the people are, and we look forward to taking care of them and our people who get to experience it year-round.
When you're walking around the rally kind of enjoying it as a doctor, do you see things that you just want to say something so bad?
Absolutely.
but you
absolutely.
You just got to kind of bite your tongue.
Absolutely. Yeah, there are a lot of poor choices being made that I would like to not.
Yeah. I don't want to see you later, sir, if that's what you're thinking.
I think most people in healthcare have found that being in healthcare has ruined some of the things they used to enjoy.
Yeah, I suppose.
And that could be one of them. And yeah, just so many different styles and the way people make choices at different times. That happens year round too.
Of course it does. I mean,
but it's a little easier to pick on that time of year.
Right. We can be just as silly in January as we are in August for sure. It's coming up, folks, and it's a little. I think it's the first this year, so it's right away. The rally's going to begin. Turn of the calendar from July to August. And
it's the 85th.
And it's the 85th. Those ones that ends in 0 and 5 always seem to be the big ones every single year. And then, obviously we roll right into the Central States Fair and Rodeo too. So August, just in healthcare alone, has to be the busiest month on your guys' calendar.
Yeah, it's definitely a time that we make sure we're prepared for. We look forward to. We don't mind seeing in the rearview mirror. And so... Yeah, we just encourage everybody to stay well hydrated, make good choices, and seek healthcare, sooner rather than later.
Exactly.
A lot of that stuff can be better managed early on. Coming and seeking care is not going to get you in trouble in any way. Even if you weren't making good choices when the injury happened, we fully encourage you to come in and be seen so we can help take care of you.
Absolutely. Well, I guess, we look forward to it whether we want to or not. So I'm glad you came in and kind of laid out, what you can do just to make sure you guys stay healthy.
Yeah.
Dr. Joy Mueller from Sturgis, Family Medicine in Sturgis. Thank you for coming in again, Doctor. I appreciate it.
Thank you.